Hi guys, this is Dr. Fajan. I hope you guys are doing well. It's a pleasure to connect with you. Today I want to talk about how to regulate yourself as a parent when your child is going into a procedure. How to regulate yourself as a parent or as a family member when a loved one has to go into a procedure, be it surgery, be it any type of big event, right? That there's some risk involved. How do you do that? So number one, engage in routines. Engage in your routines. So yes, you have a lot of emotions that you might be feeling, right? But continue to do your exercise. Continue to pray. Continue to meditate. Whatever you do normally, do that, right? Don't allow your emotions to overtake you. Yes, process your emotions. However, don't allow it to overtake you, where you get into that freeze state. So how do you get out of that freeze state? Because sometimes your anxiety can be on such an extreme level where you're like, oh my goodness, what's going to happen? Oh my goodness, oh my goodness, oh my goodness, oh my goodness. And then you just start getting into that, jumping from one visualizing one negative scenario to another negative scenario, right? You want to talk to your therapist as well. That's how you process your emotions. Go reach out to your support system, right? So they can motivate you. They can encourage you, give you those share those supporting words with you, right? Sentiments with you. Next, remind yourself the benefits of the procedure. You can say things like, my loved one won't be sick anymore, right? It needs to get done. You want to be the space for your loved one versus the resistance, right? You want to be the space of healing. Next, remind yourself you have nothing to fear. What do you do the day before the surgery is about to take place? What can you do? Or the procedure is about to take place? What can you do as the family member? Remind yourself and make decisions based on, how can I make myself okay today? What will be nice and calm for me? So reduce or take things off your plate that's going to only increase anxiety. Just don't do it. So if you've had, let's say, something planned that's going to involve a lot of anxiety, don't do it. Don't do it. Right? Next, remind yourself, this emotion of fear and anxiety isn't serving me. So say this to yourself. This emotion isn't serving me, right? And go back to your old identity, which maybe lived in a lot of fear in the past. And say to yourself, this will only reinforce old loss. So when you start thinking fearful thoughts of what might go wrong, right, and you get into that state, it's going to remind you of the old loss that you've probably had in your life, like another loved one that you might have lost. So that surgery or that procedure might, again, trigger those past events. Like, when maybe your grandma passed away or your father passed away or a parent passed away, because you start thinking in that, it becomes like a domino effect of loss, possible loss. This possible loss or possible risk in the surgery will only remind you of the old losses you've already had, right? So again, keep telling yourself, this emotion isn't serving me. Next, lower your attention to that problem, right? Over and over, overcome that emotion. So if you keep thinking about the surgery / procedure, is going to only put you in that negative state if you keep thinking about the fearful aspects of the surgery. So lower your attention to that problem. Next, remind yourself that states of stress cause sense of lack of control. You keep thinking things are going to get worse, right? You could jump from one problem to another. And that state gets your brain to become incoherent. And you don't want to be in that incoherent state. That's when the brain doesn't work right, right? We start not working right, start to not work right, right? We get into this really, really negative, incoherent state, and you don't want to get there. Rather, put attention on space, right? On good energy. Because stress only causes feelings of loss and lack and fear and separation. Remind yourself of that. Next, make a declaration of independence and say, nope, I'm no longer accepting it. I'm no longer accepting it. No longer surrendering to the negativity. No longer going unconscious to the fear or what might go wrong. Or no longer paying attention to it. And I'm not going to believe it anymore. I'm not going to believe it. I'm not going to live in fear anymore. Again, moving forward, unmemorize emotions that keep you connected to your past in that fearful state. And say to your body, no, 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 no. I'm in control. Stop thinking this way. Stop getting into those states of fear. Right? Because then you're not going to be that space of healing for that person. So these are certain things you can do right before a loved one goes into a procedure or goes through some challenging that they're about to go into some risk, any challenge that involves risk, right? All right, guys, I hope this is helpful. Take care of yourself. You guys rock.